this will be in this second lecture, inshallah, next week. Sorry, my voice, I have pharyngitis, that's why my voice is a little bit. To start with, introduction. 6 is a most important drive in our life. It is not one of the most, it is the most important drive in our life. As we know, eating is important for preservation of the self, بقاء النفس. And 6 is important for eating first of all. Sex. And 6 is important for preservation of the kind, بقاء النوم. لأن دافع الجوع البطني هو غريزة حب الذات وهي الأثرة والأنانية، ودافع الجوع الجنسي هو غريزة حب النوم ودوام الحياة ونقل سر الذراري من السلف إلى الخلف، فبذلك تكون غريزة التناسل أي الجنس، وبالتالي حفظ النوع البشري أهم بكثير من غريزة الأكل، وبالتالي حفظ المخلوق بعينه فهو واحد من ملايين البشر. What are the functions of the sex? Actually, either for procreation or recreation. And being recreative in itself is a drive for procreation, otherwise mankind might be vanished. In human being, the function of the sex can be separate in contrast to animals, in which it has to be for procreation and recreation at the same time. Concept of the sex, is it biological only or something else? Actually, it is biological, social, psychological, interpersonal factors which contribute all together in the sex, in determination and in the affection of the sex. Sex is a natural function, as we all know, but this does not mean that it is immune from disruption due to impaired health, cultural conditioning, or interpersonal distress, etc., etc. Sex, in its broad sense, is a therapy in itself. وخاصة إذا كان بطريقة شرعية وتحت مظلة حياة زوجية متوافقة، فالزواج بما يشتمل عليه من الجنس بمفهومه العام يعتبر الراحة والسكينة والطمأنينة والاستقرار للفرد ومن ثم للمجتمع بأسره. قال الله تعالى: ومن آياته أن خلق لكم من أنفسكم أزواجا لتسكنوا إليها وجعل بينكم مودة ورحمة إن في ذلك الآيات لقوم يتفكرون. Few points about cultural aspect. There is no biological functions affected by cultural differences like sex. It is affected by belief, values, and social norms. That is why there is sexual deviation, but there is no eating deviation, for instance. بما أن الاضطرابات النفسية تتشكل وتظهر بصور مختلفة من ثقافة معينة إلى أخرى، وإن كانت في نهاية النهايات ذات جوهر واحد، فإن علاج هذه الاضطرابات وأهمها الاضطرابات الجنسية يختلف من مجتمع لآخر لكي يكون ملائما لثقافة ومعتقدات ومعايير ذلك المجتمع. نقطة أخرى، المنهج العلمي التطبيقي يحتم علينا أن نكون واسعي الاطلاع في أخذ كل ما يناسبنا من الأساليب العلاجية المتوفرة حاليا في الساحة الطبية، وليس هذا فحسب، فيجب أن تكون لنا إسهاماتنا في تكوين نظرة علاجية ملائمة أو إحداث طريقة خاصة لعلاج هذه الاضطرابات، وألا نقتصر على استقبال كل ما يصلنا من مجهودات غيرنا في العلم وليس حق لأحد. Regarding start of behavioral therapy, the first time the behavioral therapy approach, especially systematic desensitization, were introduced for some sexual difficulty was during late 50s and early 60s. Then sex therapy by Masters and Johnson, who published Human Sexual Inadequacy in 70, was an extension of the original behavioral concepts, with its particular emphasis on communication skills, education, and couple involvement. This is the basic standard for sex therapy. Lately, more emphasis was on cognitive aspect of the treatment. Originally, it was for treatment of couples. Recent development is to help individuals without partners. Further development is to help people with physical handicaps, for example, neurological disorder. And the important aspect of cognitive behavioral approach to sexual dysfunction is the assessment. Assessment. The aim to identify and treat target behavior and not a specific sexual dysfunction. So, assessment is very important and vital and should cover the precise nature of sexual problem and its development. For example, impaired sexual interest or arousal or orgasmic dysfunction according to the presentation. Then you have to assess family background and early childhood history, sexual development and experiences, and with more emphasis on experience with masturbation in male and female. Regarding sexual information have to be gathered thoroughly, and also relationship with partner, school, occupation, interest, religious beliefs, also important. Medical and drug history and psychiatric history is mandatory. And if there is any use of alcohol and drugs, after these important points in history, we are going to examine the patient thoroughly to identify if there is inorganic factor. This is first. Second, to reassure the patient. Then mental state examination and some laboratory test which is done routinely. People with sexual disorder may come to professional attention with a variety of other presentations other than the direct sexual complaints. For example, coming with depression, insomnia, gynecological complaints, and infertility. Cognitive behavioral therapy and sex therapy is actually, it is important not only in direct psychologically induced or caused sexual disorder, but also in physical disorder. I mean in organic cause sexual dysfunction. And the example of that, men with early peripheral nerve damage because of diabetes mellitus often became anxious when they find it more difficult to obtain and maintain an erection. As a result of this anxiety, the erectile response may be considerably more impaired, as this is a performance anxiety. And not only that, it is useful also in skill acquisition technique to minimize the objective difficulties. ABC system, antecedents, belief, and consequences, the core philosophy of cognitive therapy. We have to stress on these points and analyze the presenting complaint according to this theory. A, which is antecedents, specific behavior or target behavior which occurred. B, what the person was thinking before and during and after it. C, how he or she felt about it. So, cognitive aspect of the problem may be at least as important as behavioral aspect. So, sexual dysfunctions are not necessarily symptoms of underlying personality conflicts or psychopathology as was thought originally by psychoanalytic approach. The problem, as I mentioned, might be direct sexual from the start, and if it's sexual, it may be within the frame of the specific sexual dysfunction, but sometimes it presented with other than these specific category of sexual dysfunction. For example, it might be attitudinal problem. There is no specific sexual dysfunction per se, but there is problem in attitudes of the one or both partners. For example, negative conditioning about the sex. It's dirty, sinful, or demeaning. It might be informational problem, problem with information, which is held by the partners. For example, uncertainty about the location of the clitoris, a woman not recognizing her own orgasm, believe that sexual activity must cease as soon as the male has ejaculated, and etc. It might be behavioral problem. For example, a woman always waiting for her husband to initiate sexual play, a major discrepancy between the two clients' level of sexual appetite. In the assessment interview, initially the partner should be interviewed separately. Many patients became embarrassed during the initial interview, and sometimes inexperienced therapists also likely to feel embarrassed. They should then seen together as the session follows. And also important point, we have to respect the confidentiality of the information gathered by both partners. Concepts that are utilized in the treatment in sex therapy: the need to adopt a non-blaming, open-minded attitude of neutrality or openness toward partner as well as the self. The need to assume responsibility for oneself. The need to communicate effectively with one partner, and both sexually and non-sexually. The need to be aware of one's feelings and needs. The fact that sex does not simply mean intercourse or orgasm. Going to the point of what we are going to deal with after the assessments, we might just go briefly with brief counseling, education and advice. And this is sorry for the spelling mistake. Important, brief counseling important for all cases of sexual dysfunction to decide whether they are going to benefit from it that's enough, or they will need more assessment and more sessions in therapeutic approach that will enter the category of proper or standard sex therapy. And some categories of patients, brief counseling will be enough for them. For example, if the case proves to be uncomplicated sexual problem of recent onset, or the main need is for education, or the couple have gone some way to resolving the problem within themselves, or if it's unclear whether sex therapy is necessary or not. Then, regarding behavioral approach for treatment modality that emphasizes behavioral approach, this is by Virginia and Sadok. Sex therapy, hypnotherapy, behavioral therapy, group therapy. Actually, there is not dependable, because sex therapy contains behavioral therapy, and group therapy can be on behavioral concept or on other concept. But we are going to talk generally on sex therapy as a general. Then we're going to tackle each specific sexual dysfunction alone. Sex therapy. What is the definition of sex therapy? It is a therapeutic approach to sexual dysfunction based on the concept of marital unit as the object of the therapy, as originated and developed by Masters and Johnson, in which the primary goal of treatment are to initiate educational process, to decrease the fear of performance, and then to facilitate communication sexually and non-sexually. Indications. Sexual problem of long durations. Effort by couple themselves to solve the problem have proved unsuccessful. The problem is likely to be caused or maintained by psychological factor, for example, aversive previous sexual experience, performance anxiety, poor self-esteem, or if the problem is threatening the overall relationship between the partners, I mean psychosocial interpersonal complications. And we can add to that socio-cultural implication in our culture as an indication for sex therapy. For example, if the patient presented with complaining or having problem with anal sex or homosexuality or group sex, and etc. We can add also treatability, that the partners or candidates are treatable and eligible to enter sex therapy. And we'll talk about it in contraindication. Regarding contraindications, psychiatric disorder. If it's severe psychotic disorder, this is granted. They have to be treated first because it is not eligible for sex therapy. But reactive and adjustment disorder and neurotic sort of type disorder, for example, sex phobia, they have to be treated either first or along with sex therapy. Mental retardation, alcoholism, also. If there is any major current alcohol abuse, it have to be treated first. Then general relationship. Sex therapy should not be offered, at least initially, if the sexual difficulties is largely symptomatic of problems in the couple's general relationship. They have to be treated by marital therapy, then proceed to sex therapy. Pregnancy it is unwise to begin sex therapy during pregnancy. And last point is motivation. We have to assess real motivation, not what's apparent from the first look, because apparently poor motivation may reflect lack of understanding rather than poor motivation. But if the patient or one of the partner or both are not motivated, so no use. What are the characteristic features of sex therapy? It has to be the basics of sex therapy: dual sex therapy team, conjoint therapy, communication, education, graded tasks. Stages and component of sex therapy. As I mentioned before, it started with assessment and formulation of the case, homework assignment, counseling, education, at the end termination and follow-up session. Approximately weekly treatment session lasting 30 minutes to an hour of an average 8 to 20 session is enough. We'll talk in detail about the homework assignment. Homework assignment important and useful to provide a structured approach to identify specific maintaining factor and to provide specific technique as it needed and according to the situation and individual case. To start with the stages, non-genital sensate focus to help a couple establish physical intimacy in a relaxed fashion and to allow open communication about feeling and desires. As it is a mean, doing, and the partner have to do it as a mean of physical awareness by the partner doing the touching and not specifically for sensual pleasure or even sexual excitement or excitation of that being touched. There is no intercourse and no touching other genitals and woman's breast in this phase. When he or she feels like it, they should invite he or she should invite the other partner for a homework session wherever the couple wish and naked with low lighted room, exploring and caressing the other partner's body all over except the no-go areas. It will take about 10 to 30 minutes, but they should avoid becoming bored. Some couples find that some sort of jellies or lotion enhance the pleasure, and the duration or average duration 3 sessions per week will be enough. Then we proceed automatically to genital sensate focus. Facilitate sexually arousing caressing without undue anxiety. To make their caressing more sexually arousing, involving both partners' genitals and woman's breast. And here, this is the important stage in which we introduce certain specific technique according to specific sexual dysfunction. Then, vaginal containment, which is an intermediate stage before full sexual intercourse begin. When they are both feeling relaxed and sexually aroused, the female should introduce male organ into her vagina in female superior position or side-by-side position and maintain containment as long as they wish. They might repeat containment up to 3 times in any one session. Then to introduce movement during containment. So it is different from actual sexual intercourse. It is not the same. General principles regarding applications of these homework assignments. Instruction must be detailed and precise. We have to check that the couple have fully registered and understand the instruction. We have to ask the couple how they feel about them and whether they anticipate any difficulties. Not to move on the next stage until mastering the previous one. Couple will be asked for detailed feedback on progress. Our hand have too many functions. One of the functions is hand riding technique used as means of non-verbal communication during certain stage of sensate focus. The person being touched may indicate preference for changes in tactile pressure, tempo, or position by this technique. Regarding treatment of specific sexual dysfunction, to start with hypoactive sexual desire. Actually, it is not easily treated, even with cognitive and behavioral approach within the sex therapy. But a man with inhibited desire told to masturbate to demonstrate that full erection and ejaculation are possible. Here we are using masturbation if needed, and it will be physical. And if there is any fantasies, it have to be acceptable within the frame of the culture and religion. We can use also Kegel's exercise to enhance the desire. Psychodynamic approach might be an alternative if this failed. Sexual aversion disorder to be treated by proper sex therapy, as I mentioned. This is the general sex therapy for all the sort of sexual dysfunction, with the emphasis on some techniques. Here we introduce a relaxation technique and systematic desensitization in the sex therapy. Female sexual arousal disorder have to be treated by sex therapy, individual or with couples. We're using sometimes sexual fantasies and water-soluble lubricants to increase the arousal. Cognitive behavioral. I mean, this is the same as this is because I did before. The sex therapy with great emphasis on current trend on the cognitive aspect, as I mentioned earlier. This is comfortable position for female stimulation. This is very important in case of hypoactive sexual desire. Come to male erectile disorder. This is which is common problem we are facing in the general practice. Have to be treated by proper sex therapy, individual or couple, with specific technique that waxing and waning exercise. It means that at the moment before ejaculation, they have to stop and go back to non-genital sensate focus and from the start and going again. So they have to make like this, waxing, reaching about to ejaculation, and then stopping the technique and going back, starting from the starting point. It might be repeated 3 times per session, and with more concentration on cognitive and behavioral aspect. Erection improve in 50 to 80% of cases, and sexual satisfaction in 90%. Also here, psychodynamic approach could be an alternative. This is training position for ejaculatory control, which is important in case of, as I mentioned before, the sexual arousal disorder. Premature ejaculation. Yes, female. Yes, before this one. Female orgasm disorder. Sex therapy, individual or couple or group, with great emphasis on masturbation technique, and in some book they wrote bibliotherapy. The male orgasmic disorder, delayed or retarded ejaculation. Here, masturbation technique is very important and vital to start with. It might be done by himself, by the patient himself, then to concentrate more on genital sensate focus in the standard sex therapy, and the position suitable here is male superior position. And it can be enhanced by pulling skin at the basis of the penis downward by the partner. But if the masturbation is going to be done by the partner, I mean female partner, by forcing ejaculation, then female superior position will be suitable. Counter bypassing, it means that helping the man express feeling about how difficult and unpleasant sex is. and actively voicing his negative feeling during sex in order to encourage higher level of pleasure to erection without the demand to have intercourse until he feels really aroused. And this is to be done with bodywork therapist. And this is becoming to the cultural point at the end.
طيب لحظة اوكي لا طيب لا
امسك الترولي نفسه ما يمشي.
هاي هو اللي يرجع ورا قاعد يرجع ايوه هذه طيب
Premature ejaculation, stop-start technique, when the male approaching, he's in the orgasm stage or phase, and about to ejaculate, he will give a clue according to agree if it's verbal or something behavioral with his partner to stop doing sex and resume it thereafter. Or squeeze technique. If this failed, the squeeze technique, according to maneuver we are going to explain after this slide, this is also before the time of ejaculation to inhibit the sexual reflex arc. And here the squeeze technique, maybe at the frenulum, or it might be at the basis of the penis, and sometimes another sort of behavioral ways, sometimes teasing the other sides in the body which is sensitive to anything which if it inhibit the sexual excitement and arousal can be beneficial. And some mention that even taking respiration also, controlling the respiratory patterns can help. Relaxation technique is important. And regarding squeeze technique, not to be too long actually, only for about 15 to 20 seconds, can be repeated 3 times a session in a female superior position. Regarding dyspareunia, sensate focus, the sex therapy classical with great emphasis on sensate focus exercise and cognitive imaginary and specific position, for example lateral coital position. And this is the squeeze technique for treatment for premature ejaculation. Anterior landmark of this is the frenulum. Here the side of it have to be anterior posterior, not lateral. Have to be pressed either anterior to posterior, posterior to anterior, not lateral. And this is the second maneuver, basilar squeeze technique. This is female superior position, coital position, important and this is lateral coital position, important in the case of dyspareunia. Then coming to the vaginismus, any case of vaginismus have to be treated or tackled with these 5 steps. To start with, positive attitude toward head genitals, then relaxation technique, certain pelvic muscles exercise, vaginal penetration either by finger or dilators, then vaginal containment. We are going now from this. This is the diagram illustrating what's going on in vaginismus. This is constriction of the outer third of the vagina here, which is responsible for vaginismus. After this discussion, specific sexual dysfunction, we're going to this next point, which is counseling, management of early and later difficulties. Early difficulties, for example, homework session, lack of spontaneity, this is very common. Later difficulty, for example, couple stop having homework session. We have to work in these fields. This is very important from cognitive point of view, cognitive model. Here, this is a homework assignment. Patients or parties coming with negative response, non-agreed behavior, and this will lead to avoidance. So we have to work in this particular time to identify the automatic thoughts which is emerged from dysfunctional attitudes which is stemming from previous or other current experience. That's why in the treatment or in therapeutic approach to deal with these things, patients are urged to use fantasies to distract them from obsessive concerns about their performance, because usually they are very concerned about how they will do it. This is what is called spectatoring. So this spectator role, we have to deal with this by distracting the clients from thinking in this way to another field which is enjoyable in the sex. Regarding education, reading materials, actually we have enough quantity of reading material, but the problem is the quality of the reading materials. Many examples given by many authors in books. For example, Delvin is in 1974, Phillips and Roxon in 1978, Zilbergley in 1980. In Arabic books, تحفة العروس محمد مهدي الإسطنبولي، حياة الجنسية دكتور صبري القباني، مجموعة كتب الدكتور أيمن الحسيني، لحظات حرجة في حياة المرأة الدكتور عبد الله باسلامة. A lot of book, but what we are lacking actually the quality of the book for individual cases and how to, in scientific way and approach. Educational session, sexual anatomy and physiology and stage of arousal have to be educated for the partners, myth, and to identify if there is any myth about sexuality, and giving them proper advice and explanation. And here the point that we can use from our culture and from Prophet sallallahu alaihi wasallam regarding sexuality and advice regarding sexual intercourse. عن جابر بن عبد الله رضي الله عنهما قال: تزوجت فقال لي رسول الله صلى الله عليه وسلم: ما تزوجت؟ قلت ثيبا. فقال: ما لك للعذار ولعابها؟ أو قال: فهل جارية تلاعبها وتلاعبه؟ عن جابر رضي الله عنه أن رسول الله صلى الله عليه وسلم نهى عن المواقعة قبل المداعبة. روي عنه صلى الله عليه وسلم أنه قال: لا يقعن أحدكم على امرأته كما تقع البهيمة ليكن بينهما رسول. قيل وما الرسول؟ قال: القبلة والكلام. روي عن النبي صلى الله عليه وسلم أنه قال: ثلاثة من العجز، وعدد منها أن يقارب الرجل جاريته وزوجته فيصيبها قبل أن يحدثها ويؤانسها ويضاجعها فيقضي حاجته منها قبل أن تقضي حاجتها منه. عن رسول الله صلى الله عليه وسلم قال: إذا جامع أحدكم امرأته فلا يتنح حتى تقضي حاجته كما يحب أن يقضي حاجته. عن عائشة رضي الله عنها قالت: كان رسول الله صلى الله عليه وسلم لا يؤتى بالإناء فأشرب منه وأنا حائض ثم يأخذه فيضع فاه على موضع فيه. وإن كنت لا أخذ العبد أي اللحم المختلط بالعظم فآكل منه ثم يأخذه فيضع فاه على فيه. وقمة وروعة التصوير العلاقة الزوجية بما فيها الحياة الجنسية تتمثل في تمثيل أو تصوير القرآن الكريم للعلاقة الزوجية باللباس، حيث أنه لا يمكن لأحد أن يستغني عن اللباس. هن لباس لكم وأنتم لباس لهم. ونختم بالآية التي بدأنا بها: ومن آياته أن خلق لكم من أنفسكم أزواجا لتسكنوا إليها وجعل بينكم مودة ورحمة إن في ذلك الآيات لقوم يتفكرون. Regarding termination, it has to be gradual, about 2-3 sessions. Then we come to the outcome of sex therapy. It is worth it to do sex therapy or leave it from the start. Before mentioning the results, method of assessing progress by meaning questionnaire and inventory. These are the example of questionnaire and inventory used, but actually I failed to get more detail about them. This is mentioned only in one book. Result of the treatment. From uncontrolled studies, 2/3 of the patients appear to gain substantial benefit from the treatment. And this is the result actually from uncontrolled study. In controlled study, it indicates the superiority of sex therapy over other approaches, but often the differences have not been vast. Of the male dysfunction, erectile problem, and premature ejaculation do best. Of the female dysfunction, vaginismus usually has an excellent outcome. Reasons of failure, we have to reassess the individuals and couples separately and altogether to identify and to allocate if any factor responsible for the failure. And most common factor playing major role here is major general relationship difficulties, and this is, I stressed on this point from the start, desire of one partner to be the same for one reason or another, psychopathology in one or other partner. Regarding application of sex therapy in Muslim cultures and what is acceptable in our cultures and beliefs and social norms, actually I grouped some of these techniques and concepts and divided. Either it is categorically contraindicated, which is totally not acceptable in the culture, and the category of that will be acceptable in our culture. In this category, which is acceptable in our culture, it also divided in two categories. The first one that indicated without any restriction, and the second one indicated in extreme need and in severe situation. Shall we leave this point at the discussion, because just I enumerate these points, it is applicable for discussion and controversy. To conclude, sex therapy is a well-established approach for helping couples with sexual dysfunction. It consists of cognitive, behavioral, counseling, educational treatment strategies, and it can be very effective and rewarding, with approximately 2/3 of couples deriving significant benefit by the end of the treatment sessions. At the end, we have to remember that the most potent sex organ is the communication. Thank you. Yes, we can open it. Now the time open for discussion.
I should congratulate you about this presentation. You tackled a very sensitive problem with bravery, and this is one of the good presentations that we really want to know about, especially with your background in religion and Islamic culture. This was really a good presentation. I have two questions indeed about, probably one is not that important when you say that the most important drive in life is sex. Indeed, probably scientifically, I don't agree about that, because we can live without sex. We don't have to die if we don't make sex. But without food and without drink, we cannot live. So in a way, this is not true. The second point, I would like to know about the Kegel technique. You mentioned it.
Technique.
Yeah.
Yes.
Very shortly. The third thing is about, you talked it from the male point of view. You did not concentrate a lot on the female sexuality problems. And I hoped that you made some kind of more representation about the assessment. Because one of the most important things in sex therapy is the assessment itself. What kind of questionnaires, how do we tackle this problem in this culture? And for the thing, the procedures indeed. You just mentioned homework, but you did not concentrate on how to make these things. But again, really, it was a good presentation.
Regarding the first point, Doctor, sex is a most important right. It is controversial, as you know, as you said. Whether it is a most or the most, this is known. But I quote it from the psychoanalytical point of view. Regarding the Kegel's exercise, this is to exercise the bucococcygeal muscles in male and female. The way to do it actually, in male, have to be trained to master or to control the muscles, controlling, for example, as if he's standing and going to defecate, and he is preventing that, and this, by this maneuver, he can control part of the muscles. The another muscles which is responsible for urinations, that if at the time of urination, you have to stop urination and then regain it again. Gradually, he can master these muscles which is responsible for urination and a sense of about to defecation and not to defecate. If this is have to be, I mean, in the detailed way, one by one, and gradually, then until he mastered the exercise. And also for the females, also the responsible muscles in certain movement and maneuver, she have to taught and to learn how to master these muscles. Later on, she or he can get pleasure of sex more, and also in case if there is loss of desire, they can get desire in sexual intercourse. Regarding the points you mentioned, assessment, yes, assessment is very important actually. And there is books separate and only on the assessment of these problems, mainly from cognitive behavioral point of view, but because the factor of time factor you are presenting together, that's why. Regarding the male and female, actually I enumerate all male and female sexual dysfunction altogether. But as you know, it have to be thoroughly for each dysfunction, how to, from the assessment and initiation of the treatment till to the termination, have to be many sessions and many hours to talk about it. Thanks. Any questions? Any comment?
Can you repeat the same thing I didn't?
I give you the slide. انت منور اليوم الله يعينك.
What are your references?
انت باكي اعطيك هي ولا اقول لك هي دكتور فاتن؟ انا حاطط الليست الريفرنسز معي.
And I have small comments on waxing technique.
Yes.
It has got only a side effect on the prostate. A lot of people come with a congested prostate. I mean, after using this, so they don't prolong this exercise, by the way, in the what they call it, family counseling. They just ask for a short period of waxing and weaning.
Actually, you know the philosophy behind it. Just to give the idea to the male partner that he can control the erection and ejaculation. He can't. If he get this idea, so he will not be afraid from failure of erection, which is the problem here.
I have one question. You said you have first, before treating or starting your sex therapy, you have to rule out any marital conflict, and if the marital therapy prior or has the priority over the sex therapy. And sometimes it's difficult. Which is which? Which is the cause of it? Is it the sex problem? Is the cause of the marital conflict and it's hidden behind something bigger than the marital conflict? And you have to starting with sex therapy, and the marital life will improve. Or is it that easy to differentiate? Is it that
This is very important point actually. This is a very important point, and this is why the assessment is very, very important to identify and verify which is first, if we can. And if it is easy to say, but practically, they mentioned also in the book, practically speaking, that's why brief counseling is to be started with. And in these initial 2, 3, 4 sessions, we can, after thorough assessment, we can know a little bit if it's the marital problem first or any sexual problem first. This is very valid point. So,
Well, برضه a couple of points. Number one, you mentioned that the best results we get في التريتمنت هو بالpremature ejaculation and erectile impotence. Is it?
no.
Did you say about
No, I
this?
did mention in this way. I said يعني في الكوجنيتيف behavioral therapy من ناحية الميل بيكون يعني أكثر حاجة من السكشوال ديسفانكشن تستجيب للكوجنيتيف behavioral أو السكس ثيرابي اللي هي premature and erectile.
Are you sure about the erectile impotence? Is it? You get good results in this way?
والله اللي هو ذاكر برضه بنفس ذاكر الكلام ده وكاتب إنه not all of the cases. That's why he mentioned the psychoanalytic approach in this as an alternative if it's failed. It is mentioned like this.
The second point, what about abstinence? Is it effective in treatment? Have you stopped sexual activity for some time? Is it fit in with methods of treatment?
According to the
You
presentation.
advise somebody
Yes.
to stop, for example, for some time. For
Yes.
somebody.
Yes, sure. According to presentation, and this is mentioned earlier, I mean, if we can get it from the stages of Master and Johnson, they forbidden the intercourse during the 3 phases before intercourse. So abstinence is very important and valid, especially if the clients or the partners have the idea that sex is sexual intercourse. You have to teach them and educate them the sex is broader than this, and this is one
But
part of it.
abstinence without any education, just to stop it for some time.
As separate entity
You have
without
done.
any specific thing, I do.
Number 3, it would have been better from the beginning if you talk or if you give us a brief information about the normal sexual practices.
Yes.
And then we can talk about the abnormal sexual practices. This is important.
Yes.
At different ages, in relation to age and so on, because sometimes what some people consider abnormal might be normal, so isn't it? And then there is overvalued ideas about this. Some people think that it is a matter of life and death and so on, and that's why, and on the basis of this,
We can.
is the trauma. And if you take it a serious matter, then it's very traumatic when you have impotence, isn't it? Some
To
people
know,
should not-
to know abnormal, you have to know the normal.
Exactly,
This
first.
is
And
the-
then
this is it.
here it is not traumatic because you put a lot of weight. In different cultures, people put a lot of weight and so on.
Yes.
So as to the, this is important. To
This is regarding this point, Dr. Hassan. My presentation it is not separate presentation. Actually, this is the last presentation
yes,
from the
yes,
series.
yes.
We started normal by Dr. Bella and other,
Yes.
by all the other audience.
Last point, as to the question of this, the most important instinct in the world and so on. Well, without food we do not live. Without sex we do not exist. We came in the first place through sex, isn't it? We do not make you in the factory. You have to. But I agree, it's not a question of this is better than
Yes.
that and this is most important than that and so on. But otherwise, I think really this is the first time I want to go in such complex, sensitive topic, and that is psychiatry, in fact. So we thank you for that also.
بس كمان عن الابستنس اللي بيقول عليها الدكتور حسن الحقيقه.
You want to know that?
It is important لكن it has to be connected to sex. يعني مش معناها during الابستنس كل واحد يبقى مشغول بعالمه يعني وينسى الجنس، لا. هي عشان ما يحصلش anxiety في الانتركورس نفسه بيبقى البارتنرز يعني نايمين عادي جدا لكن without trying to practice sex. فهي جزء من البروسيس نفسها، جزء حميدي انما مش مستقل أو شيء بعيد تماما عن السكس.
لا تفضل.
هو طبعا البيهيفير ثيرابي يعني very important in sexual disorders. ليه؟ لأن from experience يعني all other lines including drug treatment usually fails يعني. So you have to do some sort of behavior therapy. لكن أنا اللي كنت عاوزك تركز عليه يعني what is the types of behavior therapy that are suitable to our culture. ليه؟ لأنه اللي بيحصل الآتي يعني that these Master and Johnson techniques are definitely not suitable to Islamic culture or to our Oriental culture. Simply because يعني in my opinion يعني the office sex therapy is really completely unsuitable to our culture. ليه؟ لأن هو it is a type of I say that it is sex therapy actually between different persons in an office. It is very paid also. It is very similar to prostitution. It will not be suitable to our culture. What I would like you to specify is the last item you mentioned. That is, what are the contraindications? What are the indications